This video will demonstrate the placement of a nasopharyngeal airway, or NPA, when two providers are available. The first provider brings the patient's head and neck into a neutral inline position and maintains stabilization while opening the patient's airway with a trauma jaw thrust maneuver. The second provider examines the patient's nostrils with a light and selects the largest and least deviated or obstructed nostril, usually the right one. The second provider selects the appropriately sized NPA for the patient's nostril, a size slightly smaller in diameter than the size of the nostril opening, frequently the diameter of the patient's little finger. The length of the NPA is important. It must be long enough to supply an air passage between the patient's tongue and posterior pharynx. An acceptable method for measuring the NPA for proper length is to use the distance from the patient's nose to the earlobe. The distal tip or non-flanged end of the NPA is lubricated liberally with a water-soluble jelly and slowly inserted into the nostril of choice. Insertion should be in an anterior to posterior direction, along the floor of the nasal cavity, not in a superior to inferior direction. If resistance is met at the posterior end of the nostril, a gentle rotation of the NPA between the fingers will usually aid in passing beyond the turbinate bones of the nasal cavity without damage. Should the NPA continue to meet with resistance, the provider should not force it past the obstruction, but rather should withdraw it. The distal tip should then be relubricated and inserted into the other nostril. The second provider continues insertion until the flange end of the NPA is next to the anterior nares or until the patient gags. If the patient gags, the NPA is withdrawn slightly.